Sensory carts are placed on the units to assist in calming agitated or upset patients. Sensory approaches can be helpful for patients to more effectively self-regulate their emotional and physiological state. There are several different tools stored in the sensory carts. This video will show the best way to utilize each type of supplies. Most supplies can be cleaned with sandy cloth wipes. It is important to return clean supplies to the sensory cart so they can be ready to be used for the next patient. Some general ideas that may be helpful before reaching the sensory cart are offering to dim the lights, a quiet room, offering a rocking chair, soothing music, a warm towel, blanket, shower, or other ADL supplies, offering a snack or a beverage, or offering a source of oral motor stimulation such as chewing gum, straws, or toothbrushes. Items that can be found on the sensory cart include a weighted blanket. Weighted blankets can be used for sensory modulation to facilitate self-organization as well as provide self-control and self-comfort. The use of a weighted blanket must be supervised one-to-one for safety. When positioning the blanket, give the patient control. The blanket can be used sitting up or lying down and should never cover the patient's face. The use of a weighted blanket is most effective when only used for 15 to 20 minutes at a time. To clean the blanket, remove and wash the cover between uses. Do not use the blanket without a cover. The Stargazer can be calming for patients. It is important to note that this should not be used with patients who have a history of seizures, migraines, motion sickness, or those with visual hallucinations. It can also be helpful to ask if someone is comfortable in a dark room before using the Stargazer. Sand can be used as calming tactile input for patients. The sand can be cleaned by misting with 1% hydrogen peroxide spray and allowing to dry before replacing the cover to the bin. The sensory cat can be held by patients and mimics the breathing and purring of a real cat. This can be soothing. Relaxing photos and aromas can be calming to patients. Be mindful that some aromas are calming to patients and others may be triggers to past trauma. Be sure to explain the purpose of aromas and inquire what would be most calming for each patient before use. Labyrinth worksheets are a way to practice mindfulness. Patients can trace the labyrinth with a finger or a marker. This is a great task to get someone to focus on instead of their stressors. Other tactile items are available on the sensory carts as well. Stress balls, textured balls, Play-Doh, and fidget toys can be helpful. Sensory stones can be held by patients and have designs that can be traced with their fingers. This has been a review of what supplies are available for use on the sensory carts. Please contact the Occupational Therapy Department with any questions. Thank you.